Hello, and welcome to Whitney Young Health's virtual legacy event. Thank you for joining us tonight as we honor two leaders who are making a difference in the Capital Region and celebrate the important work of your community's health center, Whitney Young Health. My name is Antoine Harrison, and I'm the Vice Chair of the Board of Directors for Whitney Young Health Center. To start off this evening, here's a special message from presenting sponsor, CDP-PHP.
Good evening and welcome. My name is Sheila Nelson, Senior Vice President for State Programs at CDPHP and proud Whitney Young Health Board member. It's my distinct pleasure to welcome you to tonight's legacy event. While COVID has kept us apart physically, I'm grateful that tonight we have the opportunity to come together virtually to recognize all the good work Whitney Young Health has done over the last year. The Legacy event recognizes and honors community leaders who are making a difference in our community. All funds raised at tonight's event benefit the individuals and families who rely upon Whitney Young Health for their medical needs, behavioral health needs, and dental care needs. These services have become even more important in this time of uncertainty. At CDPHP, we've seen a 25% increase in claims related to mental health and substance use disorder concerns since COVID began. It's never been more important for a plan like CDPHP and a community organization like Whitney Young Health to continue our long-standing relationship as partners. We look forward to many more years of collaboration for the good of our community. With that being said, let's all open our dinners and enjoy what promises to be a fun and exciting evening, featuring the Legacy event's first ever live unveiling of our award recipients. Don't forget, last but not least, please visit the online auction and bid on some exciting items and packages. Thank you so much, and on behalf of CDPHP, have a great night.
Thank you, Sheila, and CDPHP for your continued support of Whitney Young Health's mission of helping underserved and vulnerable populations in the Capital Region receive the health care they need. It has been more important than in the past 7 months that our community has access to affordable medical, dental, and behavioral health care. I'm joined tonight by Whitney Young Health's President and friend, CEO, David Shippey. As you know, Whitney Young Health serves a critical role in helping underserved and vulnerable populations in the Capital Region receive the care that they need. Dave, can you talk about how the COVID-19 pandemic impacted the delivery of services at Whitney Young Health and how the health center responded to that need?
Sure, Antoine. It'd be my privilege to articulate that, and thank you for the warm welcome. First, I'd say, the biggest challenge was to pivot to an alternative way for us to meet the needs of our patients. And so that required, within about a week's time, to stand up a very robust telehealth system for us to continue to care for our primary care patients, our behavioral health patients. And then the next step was really figuring out a niche for ourselves in how we address the dental needs of our patients. So obviously, with the governor's executive order limiting a number of things that we could do, we were able to find a niche for us, particularly in the dental arena, where we were able to deliver a fair amount of emergency services, not only to our own patients, but to patients from dental practices around the community that were shuttered for a couple of months. I think the other piece that we had were the day-to-day operations, which had to be drastically altered. So setting up screening protocols and the ability to screen patients within each of our care sites was an added feature that we had to put up pretty quickly. I would say that, again, that rapid response, particularly within that first couple of weeks, had us moving to about 90% of our patient care being done in a telehealth fashion, and then the remainder with people coming in person for visits that really couldn't be avoided. So again, the staff did a tremendous job in reacting, as many of us did in not only our professional lives but our personal lives to the challenges that this raised.
Thank you, Dave. And watching this on television was, it was incredible to see how everything was happening, but it really hit home once it actually came to the capital region. So as a community health center, you know, Whitney Young Health was on the front lines fighting the COVID-19 pandemic. You know, how did you and your staff take the steps that you needed to reach your patients and those living in the communities that experience greater health disparities?
Well, Antoine, I think that was, was really a call to action for not only us as Whitney Young, but for every community health center in this country. We were founded on the very premise that many populations in this country, despite public and health insurance programs and other opportunities, really didn't get a level of service. And so, there were a number of things for some of us that have been around for a while, particularly back in the HIV epidemic, that there wasn't a lot we could do to treat people, but we had to get to people to help them identify their risk and identify any potential infection that they or their family members may have. So one of the things that we identified fairly early on was that the only testing venue available to people required someone to own a car or to get a car to drive through a drive-through testing site. And when the majority of the people we serve rely on public transportation, that was not possible. So we were fortunate from our experience over the last couple of years of having a mobile health unit to be able to deploy that fairly quickly. So about 3 weeks into the pandemic, we were able to set up a number of testing sites that we could bring to the community. So I think that was a clear sweet spot for us, and over time really did a tremendous job with that. In that ensuing 6 weeks, we tested people in no less than 18 different addresses across the Capital District. And to date, we've tested over 4,000 people through that testing opportunity. And again, none of this happened on our own. We partnered with local government, both in Albany County and Rensselaer County, to really stand up those testing opportunities to help us get the word out. And I think we were just incredibly pleased to know that we could play a role for those folks in the community that were unable to get to a testing site that was on the outside of town. And I think the early testing data, particularly from that first 6 weeks of testing, clearly showed that the folks we were testing, particularly people of color, were 2.5 times more likely to be COVID positive than their counterparts that were not people of color. So our very mission to get to underserved populations, I think, came to the forefront through the early days of this pandemic.
For 49 years, Whitney Young Health has been addressing the health needs of medically underserved populations in the region. And they continue to be creative partners with our organizations to ensure the health of our community. Just simply put, we are a healthier community because of their work. Thank you so much, Dave, for those answers. Now, for our first award, the Living the Legacy Award is presented to an individual whose own life and work resembles our namesake, Whitney Moore Young, Jr. This year, we are pleased to present this award to Dr. Elizabeth Whalen, Commissioner of the Albany Department of Health. Let me just say a few things about Dr. Whalen. Dr. Whalen joined the Albany Department of Health as a health commissioner in 2015 after a long career in medicine as an internist in medical practice, in managed care as a medical director for Medicaid, and for over 15 years in the field of public health and population medicine. Liza is a leader in addressing public health issues, advocating for the health equity, and works to create healthier communities through programs that serve vulnerable populations. As health commissioner, she oversees efforts to prevent communicable and chronic disease and protects the public from environmental hazards. Recently, she became the public face of Albany County's daily COVID-19 updates and is committed to protecting the health and well-being of her constituents by partnering with organizations like Whitney Young Health to reach underserved populations. And now, let's hear from our Living the Legacy Award winner, Dr. Whalen.
My name is Dr. Elizabeth Whalen, and I am the Health Commissioner for Albany County. The Health Department is involved in a variety of activities that serve to protect the health of the public in Albany County. These include activities like communicable disease, contact tracing, preparedness activities for public health, environmental activities like restaurant inspections, and providing education to the public on public health, and many collaborations with many community partners as well. We really value the partnership that we have had with Whitney Young, which is a very long-standing and valuable partnership. We work with Whitney Young on a variety of initiatives for population health, and we share a joint mission of really working to serve our underserved populations, people that are economically and socially disadvantaged. So a lot of the work that we do involves public health programming, so we may collaborate on initiatives related to diabetes. We may collaborate on issues related to sexually transmitted disease testing in schools. And most recently, we have shared an initiative to help test for COVID in our communities. So I hope that the work that we do brings what we like to call a collective impact strategy, and this is really where partnerships working together, and I would say this with the Federally Qualified Health Center, Whitney Young, and us, and additional partnerships, really the work of all of us together enables us to create a bigger impact than the work of any of us on our own. This is especially highlighted in our community health assessment, where we look at data related to important health indicators and choose ways that we'll work together in partnerships with our hospitals and many other community partners to influence health indicators in our community. Whitney Young has a multitude of roles. They do so much within the community. They provide services related to dental services, and this is so important in Albany County in particular, where 13 of our 16 municipalities do not have fluoridated water. They provide important services to the public for both prevention, taking care of chronic health problems, and also taking care of problems related to addiction and other problems that affect our communities. I'm excited and I'm humbled by this award. You know, looking at the work of Whitney M. Young Jr., he did so much work in the 50s and 60s, which were really a tumultuous time to try to impact social change. And you know, I reflect on that now. I think 2020 has for all of us been an incredibly tumultuous year and incredibly challenging with daily chaos. We're in the midst right now of a global pandemic, and we all need to work together to continue to recommit to the ideas improving the health of communities of color and of those that are economically disadvantaged, so that we can ensure that there is equity in healthcare. Looking at how we respond to COVID, one of the most important measures that we know at the local health department is important in the control of COVID is to make sure that we have adequate testing. And early on, we had our hospitals partner and the State Department of Health set up a test site out at UAlbany. Immediately, it became evident to us that not all of our communities were going to be able to get out to that site, which required a car. So we reached out to Whitney Young, and immediately I had a conversation with Dave Shippey, and he said, let's do this. And it's this kind of action-focused partnership that enabled Whitney Young to stand up the mobile testing vans in our neighborhoods in West Hill and the South End that really made a big difference for our communities to be able to get that walk-up access to the testing. So we think this is a great collaboration. It's an example of one of the many collaborations we've had, and it's an example really of the willingness and the immediate ability of Whitney Young to have an action-based response to a public health concern. You know, the partnerships that we have with Whitney Young are going to continue for very many years, and I think that, you know, the work that we do with Whitney Young really enables us to move forward to that health equity that both of our agencies have as part of our mission.
Thank you, Dr. Whalen, for truly living the legacy of Whitney Moore Young, Jr. In your very important work through the Albany County Department of Health, we thank you. All right, well, switching gears, I just wanted to remind everyone watching that there is an online auction with some great package bids. And I know that I try to sneak on there during the little times that I can so I can put my bid in. So please make sure you're checking frequently and that you're looking at these packages, because they are just, every year they get better and better. So the silent auction does close this Friday at noon, and all proceeds help individuals access care at Whitney Young Health. Well, next, we'd like to recognize this year's legacy sponsors, particularly our presenting sponsor, CDPHP, our platinum sponsor, St. Peter's Health Partners, our gold sponsors, MVP Healthcare, event program sponsors, Jonatronics, our silver sponsors, Hugh Johnson Advisors, Key Bank, and M&T Bank, and our bronze sponsors, Alliance for Better Health, Cohen Resnick, and Schuyler Companies, and the Khalil Jameson Consulting Group. Now, let's learn a little more about what has happened at Whitney Young, in this year. I don't mean to put you on the spot, Dave, but I have a few questions that our audience wants to know. So Dave, can you give us an update on how Whitney Young Health continues to grow and advance their services despite the pandemic?
Sure, Antoine, I'd be delighted to do that. I think we have a couple of initiatives that certainly were in the works prior to the world going sideways with the COVID-19 pandemic, and we are still working to realize those. So one of those is a collaboration that we started several years ago to create a kind of integrated care opportunity with Equinox on Central Avenue, and that's really a co-located, integrated kind of behavioral health, primary care, urgent care concept, where Whitney Young would be providing prompt care, urgent care in a facility particularly focused on the population that Whitney Young has served for years, but taking it to a part of the community where it's very accessible and would be focused as well for folks who present with behavioral health needs, and having it fairly accessible again on Central Avenue. Another one of those opportunities that we began working on prior to the pandemic, and I think again the mobile health concept really was highlighted during this, as Dr. Whalen just mentioned, but it's launching a second mobile health unit, which we would be doing with support of the Mother Cabrini Foundation, and they have been generous enough to allow us to proceed with getting a second unit that will allow us to have twice the space on that and a lot more flexibility to see people that are a little more physically challenged in terms of their ability to get on and off a mobile unit in a community setting.
Yeah, Dave, I saw that mobile unit, and I actually went inside, and it's amazing how the entire unit is equipped with so many medical tools to help, diagnose certain types of illnesses, and it's amazing how it's able to go to different locations and help a lot of people. Thank you for that answer. All right, our second question from the audience is, Whitney Young Health is successful in bringing health care directly to those who need it through collaborations with other community partners. Dave, can you talk about your partnership with the City School District of Albany and how the school-based health centers impact the lives of students in Albany?
Yes, Antoine. We've been fortunate for now a number of years to operate 3 school-based health centers in the City School District of Albany. Those have been located in 3 elementary schools. And again, prior to the pandemic hitting us, we had finalized our plans and moved forward with the City School District to actually place a school-based health center inside Albany High School. And for those of you that may recall, the high school had gone through some major renovations over the last year or two, and in those renovations there had been a planful approach to making space for a school-based health center. So we again began all of that planning well before the pandemic, and at this point we have the federal approval to do that we are required to get as a federally qualified health center, and then we also are a good way through the State Department of Health approvals on that school-based health center at the high school. Unfortunately, those high school children aren't really in school right now. They're learning virtually, but we are poised to have that available, particularly as soon as they get back. I would say the other thing, and again, out of chaos and trials and tribulations sometimes comes opportunity, and that is the case of school-based health center operations this year, that the state has allowed us and allowed other organizations sponsoring those school-based health centers to actually care for kids that are enrolled in any school in the school district, not specifically the school that they attend. So we are able to have a larger reach this year by attending to the needs of kids that are enrolled in other schools in the school district. So it continues to grow. As we open the Albany High School location, that will be the 5th school-based health center that Whitney Young has been able to stand up. So we're particularly excited about the high school because it brings an age cohort where we can truly make a big difference, not only for the physical health needs of those children, but also for those adolescents that are wrestling with behavioral health issues and other health concerns that they address at that point in life.
It's amazing because these aren't necessarily things that you see on television. It's not necessarily things that you hear people bragging about. It's just like the unsung hero going and taking the initiative to make sure that young kids, are taken care of and have the best health care that they can. And these partnerships are just some examples of how Whitney Young Health strategically works with other organizations with the common goal of reaching more patients and providing them with the care they deserve. So thank you so much for that, Dave. And now we're going to announce this year's Community Partner Award. The Community Partner Award recognizes individuals or organizations who help Whitney Young Health advance their mission, providing quality, affordable health care to medically underserved residents in the Capital Region. It is our pleasure to present this year's award to Kawita G. Adams, Superintendent of the City School District of Albany. Kawita is a third-generation educator who began her career as an English teacher before moving into administration. Leading a diverse school district of about 10,000 students, Kawita has worked to identify barriers to learning, such as health disparities and social issues. She believes that to improve schools, you have to empower families and build relationships with community partners. During her tenure in Albany, she has continued to address the health disparities facing students by partnering with Whitney Young Health and implementing new programs that increase access to health care. This collaboration not only helps students reach their full potential in the classroom, but it creates a healthier community overall. And now, let's hear from our Community Partner Award and winner, Kawita Adams.
My name is Kawita G. Adams. I'm the superintendent for the City School District of Albany. My role as the superintendent is an exciting role. I love being a superintendent. The challenges that we've been able to face and overcome through COVID-19, as well as just the regular day-to-day things that we have to do in service of our students, have been rewarding. From computers to our students, to food needs and food insecurities and ensuring that they're fed, to basic health care that we've been able to partner with Whitney Young in order to provide health care for our students. We have 4 schools that partner with Whitney Young with regard to our healthcare centers on site. They are Giffen Memorial Elementary School, Philip Schuyler Achievement Academy, and Sheridan Preparatory Academy, as well as our high school. It is an extraordinary partnership to work with Whitney Young. We are so very appreciative of that partnership because what it helps us do is keep our students healthy. And we know that healthier students, when they come to school, that they can participate and that they can have positive contributions in many different ways in school. And so we value that partnership because now at those sites, students can receive basic health care. They can get prescriptions and even referrals. Parents or guardians don't have to take off from work in order to go to a doctor's appointment because we can facilitate much of what they need right there on site. And so these things we value because we know that healthier students are happier students, and that partnership is very valuable. One of the things that I think is really important is just looking at the scope of healthcare. And when we have so many of our students and so many of our families that really need healthcare, those are the things that I think are valuable to our community. It helps our parents be able to go to work and stay at work so that they don't have to take off, in order to go to a doctor's appointment. But also, I think of things like, just basic dental care, that we can partner with regard to just dental care for our students, eye exams for our students, basic well check care and things like that. Those are extremely important. We have had so many of our families who have just been appreciative of having a health care clinic right there on site. Because of the convenience, many of our families walk and they may not have transportation, and so it's easy to walk to that neighborhood school in order to get those services that they need. And so that knowledge, there is a knowledge component, an educational component with Whitney Young, where we provide literature to families about, things that they need to know, immunizations, looking at proper health care, dental care, those kinds of things. That educational component really does make a difference because sometimes, we don't always know what the risks are to our own health, but then to have that educational component as a part of the clinic, our families can value that. I am so very honored that our school district can be the recipient of the Exceptional Community Partner recognition. It is extremely humbling to think that something so basic as healthcare and that partnership means so much. Those are the things that really resonate with me when we see our students getting services in our clinics, when we see the partnership that we have with Whitney Young. Faces just light up. And it is very humbling, but also very rewarding to sit here and be able to accept this on behalf of the numerous people within our district and within the partnership, and most of all, on behalf of our students and their families. One of the things that we are very excited about is the expansion of the healthcare program. It is not just limited to students that are enrolled at those specific schools. It's open to students throughout our district, which is something new, and we are very excited because now we get to reach even more students and more families so that we can promote healthier lifestyles, healthier living, healthier choices, so that we have stronger and healthier students.
Thank you, Kawita. And thank you for your leadership in expanding access to healthcare for all students in Albany. Well, we have come to the end of our program tonight. And Dave, do you have any final comments that you'd like to share?
Yeah, I'd just like to reflect on our two awardees briefly. They, again, both embody the spirit of what we are about at Whitney Young in terms of the ability to reach populations that often aren't top of mind for many folks in the healthcare community, and the difference that each of them have made, not only in our ability to program what we do at Whitney Young Health, but to reach the very people that are at the heart of our mission. I think I'd be remiss if I didn't also follow up on Dr. Whalen's comment about the chaos that 2020 has brought for us. The pandemic has certainly created a portion of that, but the environment that we find, particularly at Whitney Young, where we serve a great number of people that bring a great deal of diversity, and reminding folks that in a month's time, there are over 40 different languages spoken from patients of ours that come from all places around the globe, as well as the challenges for many people of color over the last 4 or 5 months with the events around the country. And so we are there not only for healthcare for many of these folks, we're there to advocate on their behalf, and that's really part and parcel to what we do. And so with that in mind, I think I would be remiss if I didn't draw on one of the quotes that we've used a lot over the last 5 to 6 months at Whitney Young, which is Whitney Moore Young's own words. And it goes like this: support the strong, give courage to the timid, remind the indifferent, and warn the opposed. And that has never been more relevant than it is right now and where we find ourselves now. And last and not least, I'd be remiss if I didn't thank the board at Whitney Young, and again, we've called upon them a lot during this pandemic to adjust and react and help us plan, and to the staff who've risen to the occasion to turn their world upside down and do things that many of them didn't come to Whitney Young to do, but they realized for us to fulfill that mission that we're there for, that they had to adapt and react in different ways. And so, again, hats off to them for allowing us to do what we've done. And also a special thanks to the development staff tonight, to Heather and Susan for allowing us to pull this off. And again, speaking of reacting and doing things differently, this is quite different for many of us, and it's particularly different for me in doing this in this type of forum. But thanks again to you, Antoine, for helping us out tonight. And I thank all of you out there watching us and listening for all that you've done to keep Whitney Young as vibrant as it is. Thank you.
And I too echo those sentiments. I'd like to thank Whitney M. Young staff, and I also would like to thank Dave, because this isn't a 9 to 5. You saw this thing, you saw the pandemic on television, you saw it happening, and when it happened, when it reached the capital region, what were we going to do? Dave and Whitney M. Young and his staff became the first responders, and they stood strong, and they've never faltered. And we want to thank you guys for that. And we would also like to give another special thanks to our sponsors: CDPHP, St. Peter's Health Partners, MVP Healthcare, Janitronics, Hugh Johnson Advisors, Key Bank, M&T Bank, Alliance for Better Health, Cohen Resnick Schuyler Companies, and Khalil Jameson Consulting Group for supporting the work of Whitney Young Health. And also, I don't want you to forget, you have to bid on the silent auction because I'm right there on your heels. So if you think you have something, I'm going to be right there to try to outbid you. So once again, we'd like to thank everyone for joining us this evening. And on behalf of the board, the staff, and patients we serve, congratulations again to our deserving award winners, Dr. Liza Whalen and Kawita Adams. Let's hope that next year we will be able to return to a regular event format and see each other in person again. Have a wonderful night.